Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional, a wellness enthusiast, or maybe someone curious about taking a more natural approach to your health, you are in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
Okay, so today we are welcoming our dear friend who we have both had the pleasure of working with, Kristin Evans.
Kristin Evans, BS RDH, is a nationally recognized dental educator with over 30 years of clinical experience and a strong focus on prevention-centered care. A graduate of Idaho State University, she has dedicated her career to advancing dentistry through education, evidence-based protocols, and the strategic use of clinical technologies. Widely known as the PH RDH, she is a respected authority on oral systemic health, functional nutrition, bone health, hormones, and the essential role of pH in oral wellness. Her ability to translate science into practical, real-world strategies makes her a trusted resource for both clinicians and dental industry partners. A sought-after speaker and educator outside of her professional work, Kristen is devoted to her family and takes great joy in her role as Gram K to her cherished grandchildren. Kristen, thank you for joining us. I know we all know each other via Guru Nanda, but I know Heather just recently heard you speak, and she kind of was really impacted, which is really cool to say because we obviously get to work with each other at conventions and we overhear conversations, but getting to hear each other on the professional stage is really, really cool. So what pulled you into the pH space in the first place?
Yeah, so the pH, so how it always stems, it seems like really passionate speakers have something rooted in a life event. And for me, it was my daughter was in high school struggling with cystic acne and was really, I just knew there was something that was, having to do with that because I really wanted to help her in many ways besides what maybe mainstream medicine was trying to tell me. And so I started diving deeper, and this was in like 2017 when we were like, things were starting to really go into, people were starting to really dive more into natural things, how we could utilize them. And I had gone to a CE about pH and they had talked about baking soda. And so I had started diving into, wow, like, hey, pH in the mouth is, baking soda is natural and it could be used. And then that led me on this journey to really where I am today as I've continued to focus on pH. It comes back to everything as really the foundation of disease in the mouth is really about pH. And I think our challenge as a clinician, as a dental professional, as an oral healthcare supportive professional is to really help our patients in every way possible control pH in their mouth. So that was really the driver starting for me. And from that, I have just become like, it's like a spider web. You just get all these little additional webs. As you dive into one concept, you get linked to something else that now, plants in your heart, mental health. I have a child that struggles with that. And then dry mouth and hormones and bone health for myself and going through menopause and then realizing, I'm super passionate about right now want to change the world with early screening for and education for systemic bone health. So I think that when you start down a journey, and I'm a very big God person, you start on a journey, and if you're open and willing, that journey will take you to different avenues, different really paths as you have a desire to help and heal people. And that's what I want. I want to help and heal people. So this was never, by the way, what I had planned. I planned on 30 years of dental hygiene and I'm on 33 clinical. I planned on retiring and being a grandma. but I am now on the road scheduling to speak I'm going to be 2027, an international speaker. So we're excited about some of the things that are happening, but this was not my plan, but I love it and I'm excited about it.
It's not work when it's your passion.
Yeah.
Yeah,
Yeah,
that's fun.
for sure.
I want to like circle back to that, like the cyclic or the acne issue,
Cystic,
right?
cystic acne.
Acne. I mean, where did the pH play a role in that? Just out of curiosity.
So in all honesty, it was that I was diving into anything to help her, like what? And it was starting to show that she needed to have a complete body cleanse.
Yeah.
And so because this is where my whole gut health and learning about dysbiosis and how that we can absolutely 100% be thrown off. And that's where my oral systemic really roots.
Yeah.
We're talking about roots today. So functional roots is I rooted myself in oral systemic health, realizing that everything that affects our body that is going to affect our mouth, and anything affecting our mouth affects our body. And it just stems and comes all the way back to, are we in harmony? Is everything in balance, or are we in disharmony? Are we out of balance? Are we not in homeostasis? So that's where and then because of that, I was seeking, like, how does this fit in dentistry?
Yeah.
And that's when I found out about the pH and my first thing was started working for Arm & Hammer Oral Care because they were baking soda. And I was just trying to help anything to help my patients. And that got me doing lunch and learns for them. And then at the end, I would be like, hey, I just have a little extra that I've learned about. If you want to hear afterwards, I can tell you. And many people were like, yeah, let us know. And then that's when I got to be the RDH. And I ended up resigning from Arm & Hammer. And now I'm working with a lot of different companies, actually. So, yeah.
It's so cool getting to see that there is, like you said, a lot of companies that are really, they don't see us as like, I don't want to say they don't see us as a threat, but when they see that you as Kristen, the RDH, like this product and this product and this product, they see that as collaboration and reinforcement of you're not just a sellout for this product, but you recognize that all of these things together are a good protocol for your patients to help address pH, because it's not going to be just one thing, right? It's a whole
Absolutely.
systems approach. So keep going. I know you were going to say something. I'll let you. And I think Heather had a
No,
follow-up question, but I just wanted to point that out.
Amanda,
like, it's not just one thing.
It is not. Amanda and I mean, we know this. In fact, all three of us have worked with Gurananda, and Gurananda knows that we all work with other companies too.
Mhm.
I am very open with every company I work with to say I'm not a one-trick pony. And when I speak clinically, nationally, and on any of my platforms and anything on any stage, I tell people I love to I have a picture of all the products I use. And I say, listen, we cannot box people into one product. It is not about one product. And if you box someone in, you're not being the healthcare provider you are meant to be, which is one of my programs I speak about. Is the best healthcare provider is someone who is super open to someone being able to use something, maybe even for a short time, that benefits them, and then having you use something different. I say dentistry has fit people into a box for way too long. And that box has been way too uncomfortable for some people, but they just felt like it was the only box. Like, I have to be in this box because my hygienist told me that I have to use this, and I hate it, or it doesn't work, or whatever. And now it's like, I tell people, just bust out of that box, bust the box apart, and then actually make a box that fits people, that fits every individual.
To continue on the box analogy,
there's so many
that big
great
box.
products on the market that you will not find at Walmart or Walgreens. Like,
Never.
90% of the stuff that's there, I won't recommend. There's so many great products on the market that we can use for health. And I think it's important that are the products that you're doing, are they helping to support the correct pH? Because you're 100% correct. I tell practices all the time that I work with, unless you shift the pH, like we can have a bacterial dysbiosis and you can slap antimicrobials at it all you want. But unless you're dealing with the environment and what's going on to set that situation up in the first place, and pH is number one, the thing that I usually say, pH, which oftentimes comes down with salivary flow. And
100%.
so if I tell people, if you're doing a salivary test and you're watching them spit in the vial and they can't,
Absolutely.
one thing that you
100%.
need is something for saliva, because they can't buffer. Nothing, like you don't even have to have pathology in the mouth to lead to inflammation or caries if I don't have saliva, because the saliva is not going to keep the pH.
Number one, really one of the number one focuses on screening that dental professionals need to have is saliva, like flow, like hello. If your patient is not, and I ask my patients, I ask them about first thing in the morning, I ask them about after eating or while eating. You really need to know, because do you know that most people don't understand what dry mouth is?
Yeah.
They actually have no idea that if you don't have enough moisture in your mouth, that's not right. And so I think it's up to us to say that saliva is the only natural way our body has to neutralize pH. That's it. Like, that's the natural way our body has to do it. And if you don't have it, you are going to struggle to ever reach the Stephan's curve to get yourself back into that neutral pH without an added product, or without water, or without something else that stimulates the saliva. Or, you just have to be also careful about what you use for stimulating saliva, because unfortunately, some of our dry mouth products that are out there for patients, especially at the big box stores, they tend to be acidic in nature. Mm-hmm. Why is that? Well, because we have to have a shelf life. They have to sit, and many of the chemicals that are used in there are shelf stabilizers that actually have acidity in them, so that we don't get pathogenic growth in those products. So we also have products that, if everybody knows, lemons stimulate saliva like crazy, but lemons are really hard on your teeth. And so they tend to, what stimulates saliva in an acidic nature can actually be very negatively impact the enamel, and especially dentin, which is 10 times softer. And I'm a big protector of enamel and dentin because of, recession, and I have recession. But also, many people don't realize children's enamel is it's like a millimeter, or it's the enamel on a primary tooth is so incredibly thin. And unfortunately, a lot of children are using acidic products, or they're actually, drinking or eating things regularly, sipping on stuff that can impact their primary teeth more than their permanent teeth. But then it becomes habit, unfortunately. And then there's also the other aspects, which are the internal aspects that people have that create the acid, like acid reflux. Acid reflux,
which nobody admits to having. Nobody admits to having GERD or reflux.
They don't know. I mean, okay, so it's called silent GERD. Mm-hmm. I really believe it's called silent GERD because I really believe patients have no clue that it's not normal to burp up like a vomit almost. Do you know, if you tell a patient, do you ever burp up some, when you burp, you get a little like almost a little vomit, or, throw up in your mouth. That is very important to talk about for young children, by the way. When you start seeing I had a patient come in and had 8 cavities. He was 7 years old, went through everything possible with his mom. She's totally natural, tries to do everything natural. But he was just this little kid who, he sat in my chair and he was kind of like, okay, what are you going to do? And so I said, it hit me. My daughter had come to me when she was in 6th grade and said, and it was before I was RDH. And you guys, I had no idea what to tell her. But she's like, Mom, I throw up in my mouth. And I was like, oh, well, just, okay. And I'm like, well, if you ever have that, maybe you should just rinse your mouth out with water. But I did not know. In 6th grade, she was having a lot of mental health anxiety. She was having these episodes with friends that was really, she was struggling with. If I would have known that, and as a dental hygienist, I now talk to my little patients that come in, especially if I'm seeing some erosion, if I'm seeing the little cuppings on the top of the teeth, if I'm, sometimes that can also be airway, by the way. Airway is huge so I'm a big airway girl, dry mouth. I mean, you name it, everything. But if we don't talk to our patients specifically, like silent GERD, people sometimes believe that you can wake up in the morning and having a lemon taste in your mouth is normal because they've had it for a long time. So unless they're sampling,
It's the acid.
it's the acid. But they don't know unless you talk to them and say, like when you burp, if you burp, it's still those gases can also create that. But if you're burping actually up stomach acid, man, and you're doing it more than 2 to 3 times a week, you need to be checked out. I'm a big believer in trying every way possible to get your body and your gut into better health and not be on a PPI. Because if we go down the PPI whole thing, man, PPIs really can destroy your bones and keep you from absorbing and keep your stomach from actually producing the acid it actually needs for a barrier, for nutrient absorption, for everything. That's why we're seeing oral pathogens in the gut, because people are on PPIs and that protection of that acid is gone. And
there's oftentimes individuals get the wrong idea that baking soda is too abrasive. So let's have that pH conversation. Baking soda in your water can be helpful just to help pH
100%.
balance. But baking soda, Kristen, is it too abrasive to have?
No. Yeah. So the crazy thing is, this is what I heard. I heard years, like decades ago. There was actually a scientist that said baking soda was it. And I heard that the ADA and baking, like the dental industry at the time, it was fluoride. And it was really about fluoride and baking soda helping to control acidic. And they went with fluoride and they really crushed the baking soda. Baking soda is incredibly cheap. It's accessible. It was in everybody's pantry. Back in the day, actually scrubbed their pots and pans with baking soda to clean. If you talk to an elderly patient, which I love to, they say, yeah, I went to grandma's house and we brushed with baking soda. And then they told me my grandma had all her teeth. Well, yeah. So baking soda actually has a RDH, relative dentin abrasivity. That's the index that shows the abrasiveness to dentin, not enamel, because enamel is the hardest structure in our body. So good enamel is pretty much bulletproof. I mean, you use a diamond burr to go into enamel. So it's hard, but dentin is not. So they utilize that to know if a toothpaste is too abrasive or what substance could be too abrasive. And baking soda's RDA is 7. 0 to, I think ADA allows 200, and I think 25 is the maximum they'll allow for like the ultra whitening toothpaste. And that will absolutely cause hypersensitivity to most people because it's too abrasive. Again, that protective layer is gone. But baking soda has 7. And I absolutely tell people, sometimes I say in my presentations that if I had a homeless kit to give a homeless person, baking soda would be part of that, and a toothbrush. They can wash their hair, they can wash their face, they can wash their clothes, they can brush their teeth. Baking soda actually is really, really great to use. So
I don't think I realized that the RDA value went that high. I thought it was like 180. That's insane.
And they allow up to 2 at the time that I was working with Arm & Hammer, they allowed up to 2, I think 225. Most of the toothpaste now, I mean, there were some that were at that. I mean, if anybody remembers Topol tooth polish in the 70s, that was taken off the market because it was for nicotine smokers, and Pearl Drops for whitening teeth. That was taken off the market because they ended up being super abrasive. So those we're seeing now. We had some still for whitening that, your whitening, unless it has something that lifts stain, then their whitening is going to just be an abrasive to take off stain. And so that abrasive can be too much. And baking soda they have moved, I would say the industry has now been moving to less and less and less abrasive because there was a lot of stuff put out that was like, wait, our toothbrush, our tooth brushes and our toothpaste are way too abrasive. So there you go.
100%. I needed to like clear up that debate because I see it and I'm like, no, baking soda's lovely. And we can get like, you can buy like a tooth powder that's just baking soda and maybe a little bit of mint to it. And I've had
or even xylitol, or you can mix, you can do whatever. I still love people to use like, baking soda and water, little swish.
Yeah. With the pH, one of the most powerful things I've done in the last year is implementing pH testing in the office. And it's not even that like the testing is so impactful, but having the conversation with the patient, because patients have like, unless they're an esthetician or they work in the pool industry or hot tubs, they don't know anything about pH. Most people don't, or chemistry instructor. So just having the conversation of this is what pH is, this is what neutral is in the mouth, your enamel starts to demineralize here. And I know you're a huge fan of Elementa Silver. They used to have the best pH scale on their website and they took it down. But showing patients where the majority of dental products that you find at big box stores is on that pH scale, it's like your enamel starts to demineralize here and the products that you're using are here.
So one of the things is I want you to know that critical pH is 5.5, and many dental professionals forget that because it was a board's question. So we go on with life like, yeah, whatever. But critical pH is 5.5. And that is very important as you're teaching your patient. But that's the enamel.
Right. Not your dentin.
Dentin is 6.5 or 4. It depends. I mean, it's right around that 6.5. Now, let me tell you, 6.5 is only a half a point from neutral. 7, and that's water. So if you have a patient, what do we have? 70% of our patients have perio. So we're looking at 70% of people have at least one area in their mouth that is exposed dentin. We have to be very, very careful. And I think it's important to talk to our patients about the scale, because many people think acid is going to be a high number. Like, they always think, oh, strong acid is right. That's actually a base, an alkaline. And so baking soda sits at around 8. So they hit it higher. Some of our alkaline waters are even 12. Now, I'm not a fan of patients drinking alkaline waters because I have seen clinical studies that if they're drinking it regularly, it can create possibly kidney stones. It could actually drive calcium and minerals into their depositing in their body where we don't want it. And so that is a very, very, very mineralized water. And many of them can be like 12. I mean, that's a high pH, so very alkaline. And that can throw us again into the, we don't want to go all the way over necessarily to the wrong side. But I don't mind people swishing with it for a little bit, because if they swish with it and spit it out and not take it into their body, then sometimes, especially if they really need to knock that pH down quickly, then I would do that. But acids are low, and stomach acids like 1 and 2. So when you're burping up that, or your child is regularly having reflux, and by the way, acid reflux and obstructive sleep breathing or apnea, airway issues are completely linked. They usually go hand in hand. And anybody also, asthma is part of that. And then they're using, my little grandson uses his little inhaler or stuff. And if you're using one that you put in your mouth, that is extremely acidic or chemical, sorry. It's a chemical, and we do not want our patients brushing after they're using an inhaler. They need to swish, 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 swish as much as they can, but do not, and I don't mind them drinking water too, under their physician's care, but they are not to brush for at least 30 minutes. So,
and with the inhalers, what I've been telling people, because we're seeing a lot of decay issues with inhaler use, which has to do with the dry mouth issue with the inhaler, increasing candida and the
huge candida.
Yeah. And you're going to have gum line cavities with candida. They go hand in hand together, but that mouth breathing component with asthma then makes the dry mouth issue. But I've been having people before doing the inhaler going ahead with like something like salvia gel or Perio Advanced gel that's more pH balanced, but having them just coat with a gel before actually putting the inhaler in. So we're protecting the tissues
for
and the
protection.
teeth prior to going ahead with the inhaler.
Yeah. And I also, in all honesty, I'm trying to remember the name, which is horrible. There's a company that I'm hoping to work with. They actually use that similar product in Invisalign trays, and anybody wearing trays. And so, and I think I connected to you, Heather. I think we connected because this is a product that I'm super excited to be hopefully working with, because of the fact that these patients have these trays in all the time. And if you think about your patients that are wearing night guards all night long, and if they laying down, that acid reflux again is going to be a little bit more prone for that. And then they have these tray liners in, or let's say they didn't floss before they put those tray liners in. Now that bacteria has now been secreting the acid as it's eating on those simple carbs and on the food. It's breaking that down. Its byproduct again is the acid, and then it's trapped. It's trapped in these night guards, and I never, or tray liners, or whatever you want, wearing. And I was really excited about that, thinking, and that gel could possibly also be used for that purpose.
Yeah. Yeah. I have this conversation all the time with the trays. They create an anaerobic environment that caries and perio pathogens are anaerobic.
They're like,
So
I love it.
there's that. So we're and then you don't have the saliva flow and influx of the rinsing that the saliva is going to do to help pH and cleanse the area throughout the night while you're using or throughout the day. So lately I've been having people do a couple things. I love ozone gels, but then also, Kristen, some people are getting more along the gum line. And I'm wondering if when we do have it along the gum line, it's where that acid is now sitting from the acid reflux component, or if they're mouth breathing, those are the dry areas that aren't getting. But yes, decay.
Well, I think, Heather, I was going to say, so as a dental hygienist, clinically, how many times is the margin of a crown where we get decay? So it's really, it's creating that marginal, that area that's traps and holds. Yeah. So if you do have a tray, we know those trays usually fit right at the gum line. So then they're not necessarily going to go up to a recessed area. They're not going to cover that root. They're covering mostly the teeth and not the root. And so then what they get is, again, you'll get that right at that margin. And both of us know that yeast is a biggie, and people just are not tongue scraping enough. They're not utilizing products enough and their gut is not healthy because they got to stop eating the sugar.
I was talking to someone the other day, and she said Fran had mentioned from the IOMT that when you combine ozone with hydroxyapatite in products, so now like kind of stepping that up a little bit further, when you take a product that has hydroxyapatite and put it in the tray, Rise Well or Feed Your Good Guys has hydroxyapatite.
Renanda has their new nano.
Yep. And you can take a nano product and then add the ozone into it. And the ozone actually helps the hydroxyapatite penetrate into the tubules.
Wow.
Interesting.
So see, oxygen is becoming like huge. We're starting to really understand and utilize oxygen, whether that's in hydrogen peroxide or whether that's in ozone. I mean, there's a lot
or honestly just breathing properly.
And water. Water has oxygen. How about a water flosser? I mean, driving oxygen into the oral cavity, having, just having people drink more water, and that's neutralizing pH, and it's also going to help with the oxygenation. I am excited about where dentistry is going because we're branching out into so many cool things to support so many more patients. And I feel like patients are excited about it. Like they don't feel boxed in again.
So can you explain how pH plays a role in bone loss? Because I do want to get to the osteoporosis.
Okay.
You and I definitely need to connect.
Yes.
and talk, because all the time I had an aha moment when I was listening to you. And it's a shame that I have not heard you speak up until just recently, because I've known you for years. And we've had such a great personal relationship. But I had an aha moment. Like I'm constantly teaching with the salivary test. Like sometimes if we don't have the bacteria present, we can still have disease. It's not always bacterial causes. And you're
100%.
prime example of pH. If we don't have pH, we're just demineralizing. We don't need the bacteria carve out, breaking
We
down.
don't need it. Yep, where the pH itself is destroyed.
Without pathology. And that I love testing because I can tell you, okay, we have the pathology. We have to deal with that. If we don't have the pathology, then I start teaching, okay, we need to look at gut health. We need to look at acid reflux. We need to look at mouth breathing. We need to look at pH, all of those things. But I never really thought about osteoporosis with the bone loss component. And I do have to say, I have referred probably 3 people since your class to do a scan because I was like, aha, I never even thought about bone density as a leading cause.
It's a primary leading factor of periodontal disease. No one does. I am the leading expert. I am not kidding. I'm the leading expert in dentistry on this. And it's because I got it. I have severe osteoporosis. I will never be able to say I don't have severe osteoporosis. My numbers, I may be in remission and healing, but I have severe osteoporosis and it can go sideways in an instant if I don't keep up with a different regimen for the rest of my life. But the big aha for me was that I got diagnosed with it. And then it just, same as what Heather just said, floods of stuff came into me going, is that why my teeth, I couldn't save mine? And I was like, I have night guards that made things worse for me. It just kept happening and I had no bleeding on probing. And all of a sudden I was like, oh my gosh, it's a systemic problem. It's not a pathogenic localized problem. Like this is not about pathogenic bacteria. This is about a systemic issue. By the way, 50% of young people that have some sort of low bone density, 50% of them have a underlying disease that is causing that. Whether that's PCOS, whether that's one of the big ones is celiacs. Celiacs is huge because they just don't get the vitamin D and the calcium absorption. So there are so many things. Any woman that is not having her men's cycle, so any of your patients, I ask, are you having a regular cycle? That's big to me for perio. Because if I have somebody starting to, that's going to be a big risk factor for me, is you're at higher risk for periodontal disease advancing, whether you have floss, brush, do everything, come in regularly. I do want them to come in more regularly because we want to keep that inflammatory load down. But I want them actually to find out systemically, like, is there something wrong? Is there something, do they have insulin resistance, diabetes? They have no idea. Is, all of these different things, a lot of stress, extra stress, cortisol off the charts, eating disorders, so many different things with that. But if I could just open our eyes, our field is, I believe in the next 5 years that dentistry is going to become so much more. With salivary testing, it's going to blow everything out of the water because nobody else likes to touch saliva but us. I mean, we are the perfect people for it. But salivary testing is also going to start showing us genetic biomarkers for specific genetic abnormalities, especially when we're talking about bone, when we're talking about vitamin D absorption, different drivers that may not even, they may be genetically part of someone that we're going to have to, figure out things to help them. But there are definitely things that I think dentistry will be the primary screeners for all diseases. And I'm not kidding. I think we will be the primary screeners for all diseases in dentistry because our mouth is such a key sign. And so
dive into the hormone component.
So estrogen is a primary builder for bone. So 1 in 2 women over 50 will fracture. That's the stat right now, 1 in 2. So we have 3 of us on here. Well, we already know 1. There's a possibility. I'm working really hard. My bones are building well now, but 1 in 2 women will have fractures. 1 in 5 men. And that number is increasing because we've never tested men until they're like in their 70s or 80s, or they have something happen. And now we know that my nephew was involved in a research study for cross country at a university, cross country men's team. He told me, I'll just tell you, there was a lot of osteoporosis because they are long distance, putting their bodies under extreme. So it's that fight or flight, almost stress that you start to get. And those long distance running for that long, their body thinks they need to be lighter, and so they can run faster. And so their bones end up getting less and less. Their bones aren't as dense, even though they're running. And some people don't understand that. But we know that swimmers and extreme athletes, especially runners, cardio, that their bones can be extremely impacted and they can have osteoporosis. You can have osteoporosis as a 15-year-old. You can have it's not an old woman's disease. And that is where my passion comes. Early screening, early intervention, early education to inform our patients that they have until they're around 30 years old. That's when your peak bone mass. And from then on, you don't get any more peak. And where do you want that? Do you want your peak here or do you want your peak here so that you have time to lose some as you age? But if you start here, they're fractional. And fractures, by the way, right now, the stat, 86% of people have an additional fracture after they fracture.
When you're older with a fracture, hip fracture, that results then, there was just a new study shared with a pneumonia diagnosis after. So
it takes a lot to heal a large bone. And our bones carry our red blood cells. They carry stem cells. They hold all of our nutrients, and they are powerful. We need them. And so when you have a broken bone and your body's trying its hardest to heal that, osteoporosis is a metabolic inflammatory disease. Inflammatory. So anything else inflammatory is going to impact it, and it's going to impact. It's a bidirectional relationship, and that's where periodontal disease comes in. Yeah. You not only have bad, bones, but many people that are high risk osteoporosis are also smokers, or they're drinking alcohol, or by the way, cola drinks can help. They keep people from absorbing calcium. And so people that are drinking regularly sodas with darker cola color can, but we have these patients that are not only, we know that it affects their perio, smoking, but a lot of them also have dry mouth. So now they're not getting that ability to fight the bacteria. Their pH is elevated, so they're getting more decay, which spreads around the mouth and causes inflammation and causes infection. And then we know that periodontal pathogens just love to have a acidic environment. They really enjoy that. And so it's all comes back around, but we have to stop this and educate and let people know from 15 to I really want to educate from 15 to 30 and stop saying that. I don't want people to think osteoporosis is an old woman's disease. I want to educate so early so that these young men and young women have the ability to make changes, lifestyle changes. If they're genetically compromised, we're going to make systemic changes in the sense of like how we're going to, anybody that has genetic biomarkers, I'm going to put them on a tighter recare because any inflammation could set up a genetic biomarker.
And that's where testing comes in, because you don't
testing regularly.
I've seen 4-year-olds with Perio nightmare scores. So Perio is
from their parent too.
An inflammatory disease. Yes, the bacteria excite the inflammation, but it's an autoimmune, just like, and it's an inflammatory disease. So anywhere we can reduce pathology in the mouth at an earlier time, we're going to prevent future disease, whether that's periodontal disease, dental decay, or
anything
systemic disease, because it's all about cytokines, interleukins, and that inflammatory response when it comes to those autoimmune types of diseases in general. That's where the mouth gets tied together that way.
And that's really where I want to partner with. And I believe you and Amanda are on you are on the tip of an iceberg of just the most amazing future for dentistry, for hygiene especially, is just having you both know I'm not a big bacteria girl in the sense that I don't remember the big words. But I want
That's why we keep Heather around.
I know. But I want to send someone I want to have this interprofessional collaboration so that we can then do the best for our patient. And it's really not that hard to screen. I have an office right now that is wanting me to set up a sort of a screening. I tell them everyone's individual. It's really hard to give you just this blank thing, but I do have a Bone and Balance for Life program. I'm starting. Anybody can reach out on my website. I will get you guys my website, and it just is for a free consultation to see if you want to talk about like a bone. I'll take you on a bone journey. With your bone journey, I'll be there for you to hold your hand to talk about like what we can do, what questions to ask, where you should go. I will try my hardest to do that as just someone who's been on the journey. I'm a little bit ahead in the journey, so I'm hoping to help others. And then that's the same way where we're going to need this help with oral health coaches, with people that we cannot, believe me, as a hygienist, you cannot do it all. You cannot do it all in the matter of 60 minutes. And we need to branch out and be able to have other people and utilize their specialty. And it's okay if you don't know everything about osteoporosis. I don't expect you to, but I do because I live it and I study it every single day. So have them reach out to me and we'll talk about it. And then I have them reach out to you guys for oral health coaching, especially salivary testing, because we're not going to heal. If we can start healing osteoporosis, but if we have pathogenic, if we're finding these red complex and ORS complex things, we got underlying other inflammatory things that will not let our osteoporosis heal.
Yeah.
So again, dentistry is on this. I am just so excited about dentistry.
Yeah, it's awesome. Kristen, I have to put you into the Saliva Sleuths as a referral. One of the things that in the Saliva Sleuths community, I'm working on trying to get a list of practitioners where we can have that collaborative relationship across.
We need it.
Because I think hygiene, if dental assistants are going to be able to scrape teeth and be preventative people, that hygiene needs to heighten up what we can do. And I think that's where the oral health coaching space can really utilize our knowledge and what we're learning and give hygienists a chance to really be independent. I live in Wisconsin. I'm not independent. I can't be independent clinically, but oral health coaching gives me that opportunity. And then like you said, it's a collaborative relationship. I don't know everything about what you do. I just had Amber come on. We talked about minerals and vitamins and that aspect.
Vitamin D is huge.
Yeah. So having her as a resource where I suspect someone might have a vitamin and mineral, which goes into that bone.
Yeah. And I'm a big advocate. I speak a lot about vitamin D and even calcium, good or bad. I'm a person who wants my calcium from my foods. I don't want to necessarily be taking a calcium supplement, but I think we're on this great track, but I do give grace for the hygienist that really just wants to be a tooth scraper. In all honesty, some of people just don't want to do anything else, and that's okay. But get your patient to someone, make sure you give them the ability. That's like saying that you need a root canal and not giving someone an option to see an endodontist. Like if someone needs a root canal, isn't it best to say, hey, we have a professional that you're go to. We offer it here at our clinic, but there's also a professional. Because I think that being the best healthcare provider you're meant to be, which is my course, is really utilizing the fact that we don't have to know it all. Yeah. But it is important for us to get the education or the referral out to our patients so they can find more, so that we don't just stop them in the tracks of like, okay, well, she said I may have something with my bones. Okay, well, I don't know where to go, what to do. And that's where you say, I would love you to reach out to Kristin Evans. She does a free consultation. You can see if you're a good fit. Hello, there you go.
Awesome. I have a couple questions.
Yeah.
Sorry.
Oh, you're good.
Like what would be some things that you can change between the ages of 15 and 30 to help support bone moving forward?
Absolutely. Yeah.
So, and that's challenging because I have kids in that range and
you do.
It was out the window for some of the things that I tell them. But give us
Yeah.
an idea of what things we can do. And I'm, 45.
So we
over
need
45,
to protect you, right?
Yeah.
Because this is the age where you start to recognize that you may have it.
Yeah.
And
Oh,
you
I
didn't
have
know.
perception.
You didn't know for like 5 to 10 years.
Yeah.
So I again, one of my key things is I want early screening. I want our medical system, and it's going to take time for this, but I do want, and maybe salivary testing is going to be part of this because we can see hormones, but I want a baseline. I want a baseline of our bone, and I want a baseline of hormones. Hormones, most women and men right around the early 20s is optimal. Like we are the early 20s in the most fertile, usually, unless there's underlying other issues, which we can maybe tag, with a hormone panel. But finding out, and it's got to be done the right way, because again, some people are being tested at different times of their cycle and the doctor has no idea. You need to have it tested really. So there's got to be some baseline. But if you get a baseline in your 20s, then you can then regulate it like as you go. Like, oh, wow. Like when I was feeling really good and I was young and I was in my most fertile time period for reproduction, because that's where it's all happening, was that. How do I keep as close to that as possible? Because that is okay, so we're the only species that doesn't die after ovulation. But guess what? We do. Women especially rapidly decline after ovulation because we start to have dementia, we start to have osteoporosis, we start to have an increase in insulin resistance, thyroid issues, you name it, inflammatory stuff, heart disease. I mean, there's so many osteoarthritis, just our body starts to just sort of, and it's true. Men keep testosterone. By the way, testosterone is a key bone builder for men. A lot of men now in their young 20s with low T, a lot of men that have obstructive sleep apnea with low T. Anybody that's having problems with ED is most likely high risk for osteoporosis. Testosterone is huge for men, but most men have enough testosterone until they're about 80. Now you think about that's when they start to, 70, 80, they start to get that low bone because of T. So we're looking at hormones is a huge baseline. Where am I and how am I doing? So that's huge. And then a bone baseline by the time we're 30. What's my peak bone? And right now, they're not even allowing DEXA scans until you're 6. It was 65 up until a year and a half ago. Now it's, if you're high risk, you can have one at 50. I had a friend whose insurance company just denied her at 52, and she's white, thin. Her mom has it. Like, hello, like she's at risk. And I said, pay the price and just go do it. I think it's around $200 to pay on your own. Okay. But and there's other options to that. But again, it's individualized people. And so when I give these other things right now, I want people to be very careful because it's individual. It's not for everyone. Resistance training is huge. That means you're lifting weights. I do not want you to go out and start lifting weights because you can break if you have osteoporosis. Most people with chronic back pain have probably some fractures, stress fractures, and that is leading them closer to osteoporosis too. Or they have some osteopenia or low bone and it's showing in their back. So back pain is a huge one for you if I have back pain and your patient has back pain, there's a chance that there's an issue with that. So I want people to be doing resistance training, but you, again, call me because we have to work up to that. You cannot go out and start lifting weights. You need to be monitored. But 3 times a week. You cannot be just doing Pilates or yoga. It is not going to do it. You have to be lifting some weights and you can work up to that. There's 90-year-olds that are lifting weights safely. Again, it has to be that. I'm a big proponent of nutritional education because we need to make sure that our patients, we're talking to them about healthy proteins, clean proteins, healthy fibers, and healthy fats. So we need more fiber. We need actually more protein. In fact, the protein, just heard this amazing thing about protein, that the first meal you eat after your fasted state should have the most protein in it possible at the first meal. But they actually found that the same amount of protein either eaten at the very first meal or spread out, that they had more muscle mass health and collagen and all the good things that we need for the muscles to build, which means bone. Muscle and bone go absolutely hand in hand, just like recession and perio. Tissue recession and bone recession goes hand in hand. So we need the protein feeds muscle, and then it also feeds bone. There's also K2 in protein, and so that helps to drive calcium into the bones instead of into the bloodstream, to form plaques. And then we are showing that dental CBCT scans, by the way, if anybody doesn't know this, our dental CBCT scans slice thinner than any other or any other medical device for CT, because our teeth are so small, they needed it. And so many ENTs now are starting to buy our dental CBCTs because you can actually slice them so thin. But you guys, I don't think people understand what a CBCT scan can do. It is a window of health. Like, you can see so many things in it, and you absolutely 100% can see osteoporosis. I know it from a dental radiologist that is, he's renowned, and he told me 100% you can see osteoporosis. He says, but I don't know what people do with it, because I just put it on a thing and I don't know what the dentist does with it. And I can guarantee what the dentist does with it. I've even spoken to a prosthodontist recently that she's like, I don't think it's the same bone. And I'm like, it is affected. I guarantee it. And I sent her a whole bunch of clinical research. So when you're putting an implant in, I tell people, please have your patients have a CBCT before they have an implant, especially a woman. If they're going to go in for ortho, make sure they're a CBCT scan. Make sure that their bone, that everything's good at that point. And then, everything else is just different. But vitamin D is huge too. Make sure that you're getting your vitamin D, and make sure if you're always low on your blood tests or vitamin D, get a genetic test to see if you can't absorb it or there's some issue with that. And lowering your stress, airway, like breathing through your nose at night, that's huge. Sleep. 7 to 8 hours, 8 if you can, on really good sleep is going to be a primary hormone reset, and it's going to help you. So
as long as you don't have sleep apnea, because if you have sleep apnea, your hormones are impacted again.
Well, 100%, because that is where your hormones completely reset during our deepest sleep. And so you will not get that hormone health and reset if you are having sleep apnea. So 100%, we need to have sleep studies done. Yeah, I'm a big proponent of that. So.
Awesome. All right. So you mentioned a new website. Tell us what your website is. Where can people find you?
So I'm going to have you guys link it, because it is through the Wix, or, I just have a landing page basically, because a lot of my stuff is found on LinkedIn. And so I will have on my LinkedIn also is easy to find for Kristin Evans, the PhRDH. And then I will have my website on there too. I don't have a paid site yet. I'm just working on that. I do have that, and I will have you guys link it. But it's under Kristin Evans, and it's on the Wix.
What speaking events do you have coming up? Because I know you are speaking at Under One Roof this year, but
yeah. So right now on the docket, I have a lot I'm looking into, which I'm super excited about. But right now, currently for this year, I have Florida is coming up, and I have 4 classes. I have my Being the Healthcare Provider You Were Meant to Be in My Bone Health, and Chronic Inflammation, Why It Matters. So those 4 courses will be in Florida. So if you want to come to sunny Florida in June, I just booked my tickets. They're actually super reasonable. So come to Florida. And then I'm speaking to Under One Roof. If you come to Under One Roof, I will be at the Guru Ananda booth for the whole entire time, because I am actually speaking at 7 in.the.morning on Saturday. So I'm really early in the morning. And I was like, but that allows me then to get to the booth by 7 or by 9 is a great event. And I am so excited to be there. So 7 in.the.morning on Saturday, I speak on my bone health and hormones.
Okay.
So yeah.
Exciting.
That's what I have so far. And then bring it on. Anybody that wants, contact me for sure. Instagram, I'm on Instagram. Follow me.
Yeah. Awesome. Thank you, Kristen.
Yeah, you're welcome. I'm excited. I love you guys. You guys are, I just honor you for all you're doing. I am so excited that you and Amanda are just really pushing the envelope of what it means to be a dental hygienist and really caring about our patients as whole and finding the root cause, the root. Let's find the root so we can make people better.
100%. Yeah, 100%. Well, Kristen, thank you so much for spending time with us today. And hopefully this message resonated with our audience. So LinkedIn, you said, Instagram, and your website. What is that website, your landing page?
So it's Kristin Evans, RDH, and then it's wicsite.com. And then it's /my site too. Okay. So yes, if you guys want to find me, please go on to my Instagram, which is Kristin Evans, the PHRDH, and you can go to my link tree, and then it will link you to my website. And also my LinkedIn has a link to my website. So I'd love you to go on that.
Perfect. Thank you, Kristen. We'll see you in Maryland.